morning, everyone. Welcome to the UBC Learning Circle, hosted by the Center for Excellence in Indigenous Health. Today, I would like to welcome Evelyn George, and Sage Thomas, thank you, and Marion Erickson via Zoom. Marion, could I ask you to join us? Are we all good? Yeah? Okay. Welcome everybody to the circle to talk about birthing in our communities. Today we're going to cover some traditional historical perspectives on birthing in communities, a contemporary look at midwifery, the value of breastfeeding supports, and any and all kind of conversations that pop up organically between the four of us and all of you watching from on Zoom. Before we begin, I would like to acknowledge that we are on the traditional, ancestral, unceded, and occupied territories of the Hunkaminam-speaking Musqueam people. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So as a quick reminder to everyone participating today, the topics we cover can sometimes be sensitive or emotionally triggering. Please make sure that you're looking after yourself. If you need to engage in some kind of self-care, talk to a friend, elder, counselor, family member, whatever you need, please make sure that you do so. Introductions. My name is Cole. I'm from the Tsleil-Waututh First Nation. I'll be kind of participating in the conversation wherever my knowledge base allows me to do. Other Learning Circle team members in the room today but off camera are Cynthia, our production coordinator. So for the introductions for everyone that's speaking today, I think I'm just going to ask you all to introduce yourselves because I think that that's probably the best way forward. Marion, since you're joining us via distance, could I ask you to start with you?
Okay. Hello, my name is Marion Erickson. I guess I'm webbing in from Prince George in my traditional territory, in the Dakas territory. I am a member of the Tsimasu clan, which is Beaver clan. My mother is Susan Erickson and my father is Lawrence Paul Yochelatin. And I'm really happy to be here today. I have a presentation on some of my current work and writings here at UNBC.
Cool. Thanks, Marion. Evelyn?
Good morning, everyone. My name is Evelyn George. I am Bearclan, Nibisi, Anishinaabe, and French Canadian from Ontario, living here now in BC in the Penticton area. I am a midwife. I come from a family of midwives on both sides of my family. So on my French Canadian side, my grandmothers were midwives, and also on my Anishinaabe side. And I'm here to talk about midwifery and the work of the Midwives Association of BC. Thank you for having me.
Cool.
Sage Thomas and Stage Kamloops. Hello everyone, my name is Sage. I am from Kamloops, from Kamloops, BC, the Secwepemc Nation. I am a mother of two, a birth worker, and I'm here to talk about breastfeeding.
Cool. Also, if you feel so inclined, please feel free to introduce yourselves in the chat box as we kind of engage in conversation today. So I think without further ado, we're going to transition into some of the content. Evelyn, would you be so kind as to start us off today?
Yeah, thanks. So we've done a couple of learning circles that have touched on midwifery, and we wanted to kind of revisit the subject again today where we kind of talk about birth. We thought in our planning that the spring season is a really beautiful time to talk about birthing and parenting and all of the things that kind of come with that. So we put together some information about midwifery, but specifically what I wanted to kind of touch on today about kind of how midwifery helps us to kind of bring in our teachings back into our birthing and into parenting, and I wanted to just highlight how that can be possible. I know that in various parts of the province, people have varying access to midwives and to information about midwives, and so this is an opportunity to talk about that, and I welcome all kinds of questions throughout the presentation, and I have just kind of 6 or 7 slides we'll go through, and then we'll kind of look at some questions and discussion following that. So could you move the slide, please? Or we've got a clicker. So this one?
Yeah.
Okay. So thank you for having me. I'm always happy to join you on the learning circles. And I've already introduced myself. So thank you very much. So I guess I wanted to kind of read the temperature a little bit with the participants online and see kind of what have you learned about midwives before? Have you had an opportunity to learn about midwives? Have you had a midwife, or have you known anyone who's had a midwife? Just if you'll kind of let us know a little bit where you are with that. Have you been on our learning circles before where we've talked about midwifery and you've heard me give my spiel already? So while we're hearing from you, I'll let you know midwives are primary care providers, so that means that you don't need, so here in the province we have registered midwives working, and they're paid for through medical services plan, and you would access them without a referral, so that's what we call primary care, so you can just go right into accessing that level of care. So we provide clinical care throughout pregnancy, labor, birth, postpartum, as well as care to the newborn for well people and well babies. We view childbearing as normal and healthy time in life. There are all kinds of different ways that midwives practice across the country, but the kind of uniting values are around informed choice. So making sure that when there are decisions to be made, and in pregnancy, there are a lot of decisions, and in early pregnancy, you can feel really bombarded by a lot of new information. So supporting people to make informed choices and informed decision making, choice of birthplace, so having options around where you decide to give birth or where labor may happen. Continuity of care is that idea that we want you to be familiar with your care provider, so that over time you're building a relationship and a rapport. The midwife gets to know your family or your support people, and there's a dialogue and a comfort there. Midwives make every attempt possible to attend the labor of the people that they've had in their care in pregnancy, and so that continuity can be really valuable for a lot of people. Collaboration is kind of this idea that we work in a team of care providers. So sometimes people need to see a doctor, sometimes they need extra support from nurses, and you know, we work in a team setting, we work in a community of care providers in a circle of care. Sometimes we're collaborating with social workers. Maybe if there's ministry involvement, we might be involved in supporting the family in that way, that we're working collaboratively. We don't work in isolation, and that's really important to giving the best care possible. We make every attempt possible to be culturally safe and provide respectful and personalized care. So you're not getting cookie cutter care, that we're kind of knowing what your goals and desires are for your care, and trying to meet you where you're at. And supporting the natural process, that midwives are experts in physiological birth, and supporting that is our goal, and supporting kind of the natural process of having a baby and
Cool.
parenting.
Yeah,
So it looks like there are quite a few people with experiences around midwives. There's a doula there. Hello, that's exciting. That's great.
Mm-hmm.
So we have some folks who are quite familiar, and then maybe some folks who are not as much. So we'll go through this, and it's really exciting to hear. And people are interested in becoming a midwife. That's wonderful. Okay, so when we talk about Indigenous midwifery, the first thing I always like to know is, do you know the history of birth in your community? And who are the midwives in your community? So this is usually kind of a reflective question, because most of the time people go, I don't know. Or like, you kind of ask around and people are like, who was the last midwife? And it seems to be the case that people are able to sometimes identify who the midwives were in the community, but very often there's a disconnect, you know, in terms of whether or not that person is still living, or those people are still living, or if they're able to transmit their knowledge and things like that.
Okay.
So we know that birth has its Indigenous midwives have always been there. We've always been part of birthing, and that Indigenous midwives haven't just kind of dissipated or disappeared, but there's been a very kind of calculated pushing away for Indigenous midwives. And you know, the Indian Act that banned our cultural practices, our ceremonial practices, birth was included and part of that. Social gatherings, birth is a social gathering. We know that there are a lot of kind of systemic attempts to get rid of Indigenous midwifery and to marginalize that knowledge base and our practice. And so the Midwives Association of BC Committee for Indigenous Birthing and the National Aboriginal Council of Midwives are two groups that are really trying to revitalize Indigenous midwifery and trying to look at all the different many ways that we can come together to do that and how that has value for our communities. So the Committee for Indigenous Birthing, I wanted to mention these two so that you kind of know who to reach out to if you're interested in learning more or participating in events and things like that. So the Midwives Association of BC is our professional association for midwives here in BC. And within that, we have the Committee for Indigenous Birthing. And so we have a collective of Indigenous midwives, Indigenous midwifery students, allied midwives working with Indigenous populations, and a few community members as well involved. And we're all just kind of looking at how can we support each other in this province to bring that knowledge back out and support each other to be practicing and continuing in a sustainable practice and making sure that the students who are in the programs are supported and able to complete their programs and get out there and bring birth back to their communities in the way that they are able to do that. National Aboriginal Council of Midwives has been doing this work for quite a long time now nationally and is very much becoming, or is kind of the primary voice around this nationally,
Right.
And kind of sits at those federal tables and works with individual communities across the country and works to raise the profession of Indigenous midwifery. We'll talk a little bit about that too.
Cool.
So the National Aboriginal Council of Midwives has certain core values that, and for me, I should also say, I have a position here as the Indigenous lead of the Midwives Association of BC. I'm also the Indigenous student coordinator for the UBC midwifery program, which is a new position. It's a very small position, but it's exciting as of this last year, starting in September. And then I have a role with the National Aboriginal Council of Midwives. So I wanted to share kind of the core values of Indigenous midwifery, just to kind of highlight that we're thinking about birth and midwifery and bringing birth back in a slightly different way than the way that midwifery is usually talked about. So the value of healing, knowing that our communities can do that healing work through the work of birth, respect for each other and for our traditions and our people, autonomy so people feel like they are able to make their own decisions, compassionate, understanding kind of where people are coming from and providing compassionate care, understanding the need and the importance and the healing around bonding, and that's so critical for taking care of our families and communities, the value and the medicine of breastfeeding, which is something that we'll talk about today as well, cultural safety and understanding that we need to meet people where they're at, and clinical excellence. And a lot of times when people think of Indigenous midwives, they may think that our standards around clinical excellence are different than any other care provider, but I'm here to just say that we really believe that everyone deserves excellent care, and we are confident in our ability to provide that. Education, knowing that our knowledge isn't just for us, that our knowledge belongs in the communities, and we believe in perpetuating and growing the profession of Indigenous midwifery, and responsibility and accountability back to our communities. So there's a powerful quote here by Carol Cucci, who is actually right now one of the co-chairs for NACM. She said, "The most powerful medicine we have as Indigenous midwives is to help restore and strengthen the bond between babies and families." And then I recognize someone in the photo. And I just wanted to very briefly touch on the NACM core competencies of Indigenous midwifery, of Indigenous midwives, because this is kind of a new initiative that NACM has done. And this is actually something we'll talk more about when we talk about education on the 23rd. So hopefully you'll all be able to make that learning circle as well. That's next Tuesday. We'll have a focus on education, training, and the development and growth of Indigenous midwifery. But for today, what I just wanted to mention was that we've kind of worked on and established a core competency framework. And what that does is it answers the question of what makes Indigenous midwifery different from regular midwifery. We get that question all the time. So the 9 competency areas that we've kind of established were provide culturally safe care, support rites of passage. So that means puberty rites of passage, birthing, newborn welcoming, all of those kinds of things that we consider rites of passage in the reproductive life cycle. Communicate, develop the profession, support Indigenous health and well-being, so thinking beyond the family unit and overall health. Manage prenatal care, manage labor and delivery, provide postpartum care, and provide newborn care. So those bottom ones are kind of the ones that we know we have in common with all midwives. And then the ones at the top are the ones that kind of stood out as more culturally relevant or more unique to Indigenous midwives.
Okay.
And this one really powerful quote came from a member of Thunderchild First Nation. She said when she was telling me about her birth story and how she had midwives, she felt it was so powerful. And she said, "We are healing a generation. Our son is healthy. He hasn't been traumatized. He hasn't been taken from us." And I thought that was really, it really kind of grabbed at my heart, because there's always this underlying fear of being separated from our babies and from each other. You know, like a lot of people leave to go and have their babies, and they're spending their pregnancy fearing that time of being apart. And then on top of that, a lot of us have that feeling of threat of, what if my baby gets taken away? What if I ask for help and they think I'm a bad parent? And this kind of thing. And what we want to really do as midwives is establish that relationship through the whole pregnancy, that really tells that person it's safe to ask questions. It's okay not to know everything. We're going to do this together, and we're going to do everything we can for you, your family, to be healthy. And so I really appreciated this quote.
It's beautiful.
So I guess the last thing I wanted to touch on about midwifery is just thinking about how it helps us to bring back our wellness practices. We have a lot of cultural wellness practices that are really, kept people healthy for really long time. And we think that kind of midwifery really helps to support to kind of reintegrate those wellness practices back into our lives. So taking a prevention and a wellness focus, and we know that a lot of our ceremonies didn't always used to be for healing trauma and healing ills and things like that. A lot of it was a preventative approach. It was kind of that internal kind of maintenance, and that maintenancing of well-being. And so from a wellness perspective, midwifery really takes kind of that wellness focus. Community, family supports and involvement. So this is kind of involving more people in the birth, having more people there antenatally to learn about what's happening, inviting people to learn about the different stages and labor and all kinds of things, and just kind of really involving the family and the community. Utilizing traditional teachings, medicines, and protocols. This is something that Indigenous midwives can do. And what's really wonderful is when there isn't an Indigenous midwife, or when you have a team of folks that include Indigenous doulas, I know are doing the same kind of work, are really wanting to reintegrate and bring the traditional teachings and medicines and protocols back into birth, that's something we can do as a community together, really emphasizing bonding, connecting in pregnancy and after. Breastfeeding, midwives have higher rates of breastfeeding success with the people in their care, and maintaining the intactness of families, just really working together as someone who's on the side of the family to try to keep as many people in that family together as long as possible, whether that means birthing in the community, bringing birth back, birthing closer to home, or doing that child welfare advocacy. And then those kind of wellness practices that are just embedded in the way that we are together, with being honest and being a trustworthy person and having a sense of humor, and kind of just kind of the way that we are together can be a very comforting place to be when you're at a vulnerable time in your life. That is also an extremely powerful time in your life, right?
Yeah.
Mm-hmm.
So I just wanted to share kind of those ideas. So I didn't add any discussion questions there, and I really should have, but I wonder if we want to take maybe 2 or 3 minutes to kind of hear from the group. Any questions or anything you'd like to add to that, or before carrying on?
Yeah, sure. Feel free to populate the chat box if you have anything you'd like to talk about. I actually have a couple questions, and I was hoping that you could kind of address them. Just from a place of ignorance, I mentioned earlier, or I saw earlier in your slides that you had postpartum care and support as listed as something that midwives do. Can you provide an example as to kind of what that looks like in a typical like midwife and family relationship?
Yeah, so I think one of the most important, so when we say postpartum, it's a word that we often hear associated with depression. We always think, someone might say, oh, I had postpartum, and they might be referring to having had postpartum depression. When we're using the word postpartum, we're referring to the first kind of month and a half after baby's arrived. So that's after having given birth. And so we're talking specifically postpartum care is about the person who has had the baby and their process of healing and recovery for the next kind of month and a half following. That's what we refer to as the postpartum time. So I think one of the most beautiful things about midwifery is we have the opportunity to help prepare people for the postpartum during their pregnancy. So we're kind of talking to them about, what might be coming, what might happen, how are we setting up supports, is there a plan in place to have help after the baby comes, and this kind of thing. And then when the baby arrives, we're checking in, usually by home visit for the first week and checking in that way. Because midwives are available 24/7, you can, whether it's a pager number or a call line or whatever it is, you'll always be able to get a midwife on the phone. So you can say, oh, my baby's poop is green, which is a common thing that we hear. And we'll say, okay, actually, this is the explanation for that. And kind of reassure people that nothing is as urgent or concerning and that this is actually okay. And reassure people. And we really prevent a lot of people going into hospital sometimes just by being able to say, well, actually, this is normal, or actually, why don't I come and see you and check on you, and kind of save people a lot of effort that way. But as time goes by, we're together for those first 6 weeks usually. So we're kind of working on those adjustments. And very often, if there is somebody is had depression or anxiety has been a significant part of their life before having baby, we're setting them up for supports for when baby has arrived, because we know that those things are very often magnified. Likewise, if you have a mental health diagnosis of any kind, we know that postpartum is a really sensitive time when your hormones are fluctuating rapidly and life has changed dramatically. Those are times to make sure that we're kind of set up and checking in and making sure that we're kind of supporting as smooth of a transition as possible. So that's kind of what, and from, a clinical perspective, we're making sure that the healing has happened, whether it's been a C-section or a vaginal birth. We're also checking in on breastfeeding or whatever infant choice has been made around supporting that baby's feeding and growth. We're checking the weight of the baby and the progress and change over time.
Great. So really kind of a comprehensive support for new mom and the family. That's awesome. So we do have a question from Donna. I struggle to know how to support First Nations moms in our community in a culturally sensitive way when an Aboriginal provider or Indigenous provider isn't available. How do I support traditional teachings when I don't know them? I don't want to assume people would want to share their practices with me. Is there a conversation about this? Donna, you mentioned that you were not Indigenous. And then further, how would you suggest approaching this other than just generally trying to be approachable, engage in shared decision-making, respectful, et cetera, et cetera. So I don't know about you, Evelyn, but I think that that's actually a really, really great question, Donna, and something that there is no short answer to that. So maybe we could leave that one for a discussion point. Does that work for you at the end, like once we've gone through every exactly.
Sure, I do have a response to that, but we can hold that if that's fine, because we'll be together still then.
I think it would be best if we had everybody. So I appreciate that question, Donna, and we'll come back to that when we have a little bit more time.
So my name is Marion Erickson, and I'm Daketh. In the picture you see there on the screen is my great grandma Monique McKinnon, and she was a midwife from the Daketh territory. The way that you say that midwife in Daketh is a KLC, and that means one that helps women give birth to something. Next slide. So like I said, I am a member of the Tamashu clan. You can see our clan flag on the screen there. And we come from a matriarchal clan system, so land is passed down from one generation to the next through women. Next slide. One of the things that brought me to have interest in this is that I've been a traditional knowledge researcher in the Dakas area for some time, and it was never actually related to birth. It was related to hunting, fishing. I was a traditional knowledge researcher for sturgeon with the Upper Fraser Fisheries Conservation Alliance. But along all of the research that I found, there seemed to be a connection to traditional Dakas birthing practices throughout the entire thing, and I really felt like I need to put all of this together. And once I started doing that, I found that's when I learned that my great grandma was a Dakas midwife, and that there was actually many Dakas midwives practicing in Dakas territory, and it wasn't until the hospital was built that that changed. It was funny, when I told my cousin about this, she said, "Oh, I thought we just would just squat in the bush and like move along on the trail because we were nomadic." And I was like, first of all, we weren't nomadic. Nomadic means to wander aimlessly. We didn't do that. We based our hunting and fishing in the Dakas territory on seasonal rounds, and we still do. We still go to certain areas to get moose, certain areas to get beaver, certain areas to get fish and different types of fish. So yeah, and with regards to traditional Dakas birthing, we did actually have birth lodges traditionally, and there was a lot of herbal medicines that are still used today for birthing. And we used to have placenta ceremonies. I found it really interesting because if you ever look at a placenta, it looks like a tree with the veins and stuff. But if a woman wanted to continue having children, then she would put the placenta into the tree. But if she didn't want to have any more babies, they would bury it. So that was thought of as a kind of a hope for blessing of more or less children in the future. So one of the things that I've learned throughout this is that the English language is definitely an erasure of our culture, and there's been a lot of different ways that, for example, when we say Dakas midwifery, it doesn't really fill the context of what a traditional Dakas midwife was, because KLT means one who helped women give birth to everything, and the reason is because the reason it's said like that is that the Dakas in the Dakas oral history, there's a story of a Dakas woman who gave birth to puppies, and those puppies later grew up and became men, and that at the end of the story, they talk about how those men walked into the sky, and they form what's known as the Big Dipper. So this idea of women giving birth to the cosmos is a lot different than the origin of the word midwife, which comes from it's an Old English word that means with women. So and that came out of the church, in that traditionally in European culture, the midwives would have to be blessed by a church, by the priests in order to practice, so that they were blessed by God. So it just shows like some of the pedagogy and how those are different, and how that might change the way that we view care, and the way that women used to be viewed in traditional culture. Next slide. So one of the things that I think isn't talked about in the North enough, and across Canada, is how the midwives were forced out of practice. Some of the research that I found would compare what was called field maidens. They were basically female Indian agents, and their job was to go on to the reservations and ensure that Dakas women were, let's just say, adhering to the colonial family ideals. So one man, one woman, that type of family. There's a story that I was reading about the very first, what I would say called Nadeau midwife, which means white midwife in Dakas territory, and her name was Bloomfield. And what she did was she claims that she had attended thousands of births in Dakas territory. But what I actually found out was that she would actually be paid by Indian Affairs to go and register the births, and that it was actually traditional midwives like my grandmother who would attend the births, but it was because she would register the births to the Indian Affairs that she would get extra money. And traditionally, Dakas midwives were never paid by Dakas people in the Western sense of earning a wage. So it was actually a convenient way for her to support herself economically on the births of our children, and also erase the history of midwives from the area. It's funny because she's often called. She was. There's a story in the book that I read called The Diary of Fort St. James, where she's called this angel of mercy who never seemed to tire, and that Dakas people worshipped her. And I kept reading along and further along, and later it talks about how how she got into a fight with the Dakas people, and somebody went and shot up her house. So I thought, I don't know how much Dakas people really worship this woman if they would shoot up her house. It just doesn't seem like a very Dakas thing to do. And what I actually found out was from oral history is that she was actually very mean to some people, and that was the usual way that Dakas women were treated by early settlers, was that they were very mean. And that meanness, I would say, continued on to Lejac. The top picture there is Lejac Residential School. I wondered why my grandmother never passed down her, my great-grandmother never passed down her knowledge about midwifery, and it just turns out that her daughter, Nora McKinnon, which is my grandmother, went to Lejac Residential School, and she was never able to receive that knowledge. And then now today, like with current laws of Western biomedicine, there's been a lot of effort to delegitimate the Dakas knowledge surrounding childbirth. Next slide. Eventually the Stuart Lake Hospital became one of the primary care places for Dakas people to give birth. They no longer have a birthing center at the Stuart Lake Hospital. All of the births now leave the community to Prince George. It's kind of too bad. And when I looked into that, it turns out that it was never based on any real health issues to transfer births from the Stuart Lake Hospital to the Prince George Hospital or the Vanderhoof Hospital. It was mainly out of administrative decisions and things like that. So now people say, you never see any celebrations in our community, the only thing you see is death. Oh, people just die there. They don't get to be born territory the way we used to. But I must say that I think that working in the future, there is a lot of great things about Western medicine. For one, epidurals. I wondered if how much the traditional practice was impacted by the benefits of Western medicine. Same with the gas that they give. I'm sure DACAS women were very excited when they learned about the gas. So I think that and traditionally DACAS women would not have access to the 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 being able to use the gas. But today there are a lot of DACAS nurses that practice, and they practice with sharing some of the traditional culture as well. Next slide. So you see, I know our community that there is a lot of work to be done, but we've done a lot in the DACA community to ensure that our traditional practices are saved, and there is a lot of cultural continuity, but it's just some of the challenges is the birth evacuations and also the influences from the Catholic Church. So that's something that I've kind of been working on. What I would like to do is create a doula certification program where DACAS can train our own doulas based on our own knowledge, integrating the Western knowledge that we think is right for our community. I think one of the newest concerns we have is with legal marijuana. Somebody kind of explained to me that I should maybe try CBD oil for treating morning sickness. And I was very concerned with that because I looked into some of the medical journals I have access to here at UNBC, and there just isn't enough research. I've been looking at integrating other knowledge as well. I know the Chinese are really great at treating morning sickness because they have, well, for one, there's the ginger, but also because they have a higher rates of hyperemesis gravidarum. So there's more knowledge for treating things like morning sickness in a way that isn't going to negatively impact a baby's cognition. Next slide. Another thing that I would like to bring back is some of the oral history stories. I know that not everybody in the DACAS community has learned all of the stories, because I know I've been privileged to work as a traditional knowledge researcher, and I haven't really been able to share all of the stories that I have. But I know that that if I were able to share more with the young women, that we can bring a stronger sense of self, especially to those who have been taken away. I know in my family we had people who were taken away by 60s scoop, and now we have the millennial swoop, and there's a lot of people who need greater access to this knowledge, and putting that on different mediums is something that I would like to work on. So, yeah, but for sure I would like the doula apprenticeship to be certified and approved. As of right now, FNHA has some doula certifications that are approved, but I would like one that's specific to our people and to the knowledge that we would like to share, and to the knowledge that we would like to partner with the Western community.
I just wanted to say, Heichka, a million times over for bringing that knowledge in today to talk about your community and what you'd like to see in the future. I think all of us here can agree that, particularly the way that you brought it towards the end, integrating the traditional practices of your community into Western biomedicine and finding a good way to move forward that's community driven and community oriented, I think is a really great way to proceed. So again, I just got for your perspective on that, Marion. I really appreciated it. So with that, I think we'll move over to Sage.
Sure.
There you are.
I think I have a question. Can I ask?
Sure.
you?
Yeah. Of course. Of course.
Did you find it hard finding all the research about the oral history on birthing and stuff like that?
Can you hear me?
Yeah.
Oh, for it actually came naturally, but I was lucky because of the positions that I was called to do. I worked within environmental assessment, dealing with pipelines, oddly enough. And that's where a lot of this knowledge kind of came along, and it has taken many years.
Mm-hmm.
It's been about 7 years, and I still continue to go back to the community. My grandma and my aunts have been really helpful. I have a big family, and so we're kind of lucky that we have so many people who are very knowledgeable about with the traditional practices. And I've also been kind of leaning a lot on my hereditary chief Zothai for some guidance in what needs to be done. I thought it's funny because I've noticed that I've noticed in times how genocide has impacted our community, and it has to do with the way that people remember. When I told my aunt about what I wanted to do, and she said, you should talk about the goose grease. And I was like, what goose grease? And she said, we used to use goose grease to turn the babies if they were sunny side up. And I said, really? I was like, that's so interesting. And she's like, yeah, and midwives, they were very well known for having very long and flexible fingers. I said, so, and then she said, and then I got really excited, but then she's like, but that's all I remember. And she kind of walks away. And I thought that was such powerful knowledge to have. And she just kind of didn't think much of it. It was very powerful for me to know.
Mm-hmm. Right. So we actually do have a question that came in. Do you mind, Sage, if we kind of address it as a group here? Sheila asks, are there any herbs that are used during labor? If so, what are they, and when is a good time to use them? Have you come across any of the specific teachings around herbs, or that would probably be guarded knowledge, I would imagine, wouldn't it, Marion?
Some of it is open knowledge. Some of it actually is very well known. Raspberry leaf tea. We actually use the raspberry stems as well.
Okay.
And that's something we use. There is some herbs and stuff that I've been told about that aren't written down, and that we keep that knowledge sacred mostly because of the critical place that medicine is in our community. We would love to have it not be extorted by commercial use, so we don't often share that. But the raspberry leaf tea is something that's been used to speed up labor. And it's also been used to increase fertility, and is used during the period cycle.
Okay. Thanks very much for sharing that. Thanks for that question, Sheila. I think we'd all love to. I'm sure that there are some other things that are elaborated or going to be elaborated on in your book, and we can kind of talk a little bit more about that at the end. So thanks again very much for the question, Sheila. I appreciate that. Okay, thank you. Okay, great. So Sage, would you like to kind of round us off here?
Sure. So my presentation is just talking about breastfeeding and supporting it within our community, and essentially reclaiming it in our Indigenous communities. It's something that we just did normally, and it's a part of just moving forward, I guess. And I think it's a really impactful thing to do to support our future generations.
Mm-hmm.
So it's breastfeeding is traditional medicine. Like I said, is something that was just a normal part of our everyday society prior to colonization. And it was a community effort to support moms and babies. We had everyone living in a communal way, at least in my traditional territory in Secwepemc area. We all lodged together and stuff like that traditionally. And so I feel like there wasn't as many issues as there are now with our modern society living, with moms having to go back to work and not living in the same city as your other family and having a lot of the same support that you would if you live in that communal living. And then it was also normal to have wet nurses and share breast milk for the women that were unable to breastfeed. I know today can still be something that's common in some of our communities. I know that my partner's family, they still, like, just this generation and the generation before, they still would wet nurse and stuff when the moms weren't able to nurse. So I know, and today it's something that's really frowned upon, I think, in our health field. So I know a lot of doctors and nurses might not utilize that practice, and there's a lot of kind of hoops that you have to jump through if it's something that you do want to share your milk. And there are milk donation centers and stuff here, but you have to be screened and you have to do all this testing, and there's just a lot of work. It's just not as easy as just handing somebody else your baby and them breastfeeding. So that's definitely changed and put up some barriers with that. And then breast milk has a lot of natural healing qualities. Can't really read the slide. And it's used naturally to treat ear infections, eye infections, nose infections, or even congestion, skin irritations, and healing cuts. Like, there's so many benefits to it, and I think that we don't even have all the full information to the types of healing qualities that breast milk has.
Right.
And then I just want to point out this drawing. So we have the late Dave Seymour was a really well-known Secwepemc artist from Kamloops, and I found this print somewhere. It was actually a really large print, and I just had noticed the mom breastfeeding. So I thought that was really cool because he probably did this quite a while ago. So yeah. And then, why is breastfeeding important for our future generations? There are numerous health benefits for breastfeeding for both mom and baby, and a lot of those benefits last for a lifetime. I do just want to mention too that although we can say that breastfeeding has all these benefits and everything like that, we do have to be mindful that it doesn't always work for everyone. It can be a really difficult journey, and we have to be respectful of everyone's choices. So I know that it doesn't. Yeah, breastfeeding's hard, and it doesn't always work for everybody. So I don't want to offend anyone talking about breastfeeding in a good way, but it's important that we do talk about it. Breastfeeding is also cost effective because it's free. So I feel that a lot of times in our Indigenous communities, it's fairly well known that a lot of us live in poverty, and it's a great way to kind of save money when you're starting a new family, and formula is very expensive, and so breastfeeding is a good way to help cost. And it's also very friendly to the land, which I think is very important to our teachings. Being environmentally friendly and conscious of the waste that you're creating. And realistically, breastfeeding doesn't create any waste and no carbon footprint. And then it is a part of our food sovereignty, food security. It's sustainable. It's always available. I don't know if you want to talk more about that.
In terms of food, well, I think that there's always this need for our communities to be more food secure, whether that's because of being isolated or because of financial constraints and things like that, and having a method of feeding a child that is virtually free. I mean, I think one of the challenges that we have actually with bringing breastfeeding back to is that a lot of times our programs in our communities will provide formula for free. So, but when we're thinking about, you know, in the absence of resources from the outside, what are our communities able to do from the inside? Breastfeeding is one of those feeding methods that can be done from within the community. And of course, you know, the challenge with breastfeeding is that the process of colonization has been really hard on women's bodies in a lot of ways, and that breastfeeding is complex and layered, and requires a lot of healing sometimes around it, even just to talk about it. So like what Cole was saying about taking care of ourselves as well, but noting and remembering the medicinal value of breast milk, and thinking about the circumstances of our communities and the need for food security and sustainability and our ability to provide for ourselves within our communities is also an important conversation as well. So it's just to touch on that.
I think also one thing I didn't really mention here that I was thinking about was that, you know, talking about the 60 scoop or even a lot of babies being apprehended, that kind of cuts down that bonding and that time to breastfeed. So when a baby's apprehended at birth, oftentimes they're not able to have that first initial breastfeeding, which is really unfortunate, because I feel like that I think that's a really important time for mom and baby to bond, and when that's taken away, you know, it just creates all these other things that happen. So by being able to support that by like social workers and health nurses and everything, really advocating for that that time for mom and baby to stay together and to build that relationship of breastfeeding. And I know in my community, they are trying to work towards doing their best to keep mom and babes together and to support breastfeeding in any way that they can. And so I would like to see more of that happen throughout our country. And so here I'm just going to talk about a little bit about community support. And in order for breastfeeding to be successful amongst all Indigenous community members, I think one of the things is that it's not just, you know, it shouldn't be just relayed on the mom and baby to continue that relationship and that journey, but it's up to everybody in the community to support that. And so especially some of the things that we can do when we're at gatherings and feasts and ceremonies, and because as Indigenous people, we're always gathering, just to make sure that there's available seating for pregnant and breastfeeding moms, comfortable seating, that we're offering food to the little ones, but also our pregnant moms, our breastfeeding mothers. They're often hungry and underfed and tired, and don't always get the nutrition that they need, and we need to remember that they also need that extra nutrition just as much as our elders, and to always make sure that there's clean, sterile drinking water available at gatherings, and that we are offering food and offering water to the pregnant and breastfeeding mothers, or any moms with infants, and offering to help either serve them food or hold babies so that they can get food and stuff like that. And then just being mindful and respectful to help normalize breastfeeding, being aware that we're not shaming anyone and telling them to cover up or that they should cover up or go to another room. And then, like I said, respect everyone's feeding choices in their journeys of parenthood, because everyone's an individual person and everyone has to make their own choices, informed choices on what works best for them. And then we can also look at baby-friendly initiatives in our communities, in our health centers, and really supporting that. And then, so here I talk about lactation support. So there's different levels of lactation support. So often for breastfeeding, I think to be very successful, we need to be able to reach out to our community members and find out who our network is that we can contact or be in connection with to find the support when we are having issues. I find often working in communities, in First Nations communities, people just don't know where their support is, and they don't know who to ask for help. They don't know that although there might be some issues, they don't have to just end breastfeeding, that, you know, they can just try and find solutions to their problems. And so the best help would be a lactation consultant. So it's IBCLC, so internationally board certified lactation consultant, and oftentimes these are our professional care providers such as doctors, midwives, registered nurses, and they work in the hospital or public health and breastfeeding clinics throughout the communities. Sorry. And then they are breastfeeding counselors or educators. Oftentimes these are doulas or people that are fairly passionate about breastfeeding. There's the Leche League leaders, and those are groups that are led by people that are trained in breastfeeding through the Leche League and oftentimes they gather like I think once a week or a couple times a month. It's always different in different cities, and they just talk about different topics. I think each gathering, it's always different depending on where you're going and getting that support. But the leaders are usually always available to talk to, like through phone anytime. And then there's things like breastfeeding cafes. I know in Penticton, that was one of the first breastfeeding cafes started in the province. And then when I moved to Kamloops, I started one there. It was a great opportunity to connect with other moms that were breastfeeding. And so I was able to find new friends that were breastfeeding, because I found that going to other mom and baby groups, there's not always parents that are breastfeeding or have similar values to you. And so it was a great way for me to be in a space that was comfortable for me to breastfeed and talk to other moms and talk about things that you might not talk about with a healthcare provider. And then we also have local community breastfeeding awareness, advocacy, and promotion groups. So in Kamloops, we have Breastfeeding Matters in Kamloops, which is BMIC. In the Okanagan, they have the Okanagan Breastfeeding Coalition, which is known as OK Breastfeeding. And I'm sure there's other ones elsewhere throughout the province. Those are the ones I'm aware of. And so those groups are there in the community, led by oftentimes the lactation consultants, doulas, some midwives participate in there. And it's just an opportunity to get out into the community at different events and promote breastfeeding in all sorts of different capacities. So one thing that we do in Kamloops that we started, I think it was about 3 years ago, we started going to the Living Green Expo, which is a gathering to talk about environmentally things that are happening in the community, so in Kamloops. And so we're there to talk about how breastfeeding has a very low impact on the environment. And then I just have another point there about there's an underrepresentation of Indigenous support people. And I think that it's a very high demand and need for that culturally safe support and support people that are trauma informed as well, because Indigenous people have a lot of past trauma that they need a different type of support, I think, rather than
of course.
Yeah. And then so here I've just included some breastfeeding resources that I find very helpful. So there's Dr. Jack Newman, and they have a lot of great articles and stuff on a lot of different breastfeeding issues. And then La Leche League, where you can find your local La Leche League leader or group. Kelly Mom, I always found really helpful. There's tons of information on there, and it's all researched and well looked into. And then I've also put the World Health Organization, and so people can find more information about baby-friendly initiatives and what that means. And then I found this really great article. It's by Well for Culture, and it's a dad's view on supporting breastfeeding. And so he talks about different things that a dad can do to support the mom breastfeeding, and how in today's society things have changed and our roles have changed. And so there's some great points there.
Great.
And I think that's it.
Awesome. Well, thanks very much for that. Sage, I really appreciate it.
About one initiative that I think people might be really interested in. So, Ganasatake Mohawk community in Quebec have been the first community to become breastfeeding friendly. So they went through the World Health Organization breastfeeding initiative, and they were the first First Nation health center to be breastfeeding friendly designated. They did specific breastfeeding training, and then they actually will visit. Well, other First Nations will send people there to do breastfeeding training, but they have also visited other communities, I believe, as well. And so we've seen, from a national view, in my national work, we've seen a few communities receive breastfeeding training from the Ganasatake cultural breastfeeding curriculum. That's been really successful, because there is a desire in communities to bring this back, but people need that knowledge and need to feel confident in it, and need to feel confident with their skills and knowledge around supporting that. But there definitely is motivation. I think we're just kind of like, where do we go and how do we do that? And so it's kind of neat to know that in other parts of the country there are First Nations specific community-specific initiatives around this that have kind of met their community's needs and addressed their kind of unique context in terms of addressing trauma and addressing the different kind of complex layers that our communities are dealing with when we're looking around feeding options and looking at breastfeeding and things like that. So I just wanted to mention about that. I'm sure that it's Googleable in some shape or form, but maybe we can try to find information to put along with this one when
certainly.
It gets posted.
Certainly. Any of the resources that we mentioned in session, we'll do our best to catalog and provide for you at the end when the YouTube video goes out. So Sage, again, thanks very much for that. Particularly that resource on the dads and supporting breastfeeding. That's really critical, and something that I think about, like, as a male in this setting and in this space. Really, a lot of what I'm hearing and what I'm engaging in is like, okay, so this great knowledge, great information. How do I then take that and support my own family? Like, what is my role in it? You know what I mean? Because so much of it,
and I think
can't participate in.
I think it's not just like a dad's role, but it could be an uncle's role or a brother's role or a grandpa's role. Like any kind of male role that is in that family can help support breastfeeding too. Yeah. And I think oftentimes that with a partner, they want to be involved and have that bonding too, but there's other things that they can do for that relationship. It doesn't have to be feeding the baby, but it can be helping mom feed the baby. What can we do to help mom be successful with that?
Yeah.
And in midwifery work, it's funny, I was at a conference and there was a whole bunch of admin people from a particular First Nation. And they came by the midwife desk at NACA, where I was, and they were kind of interested. And then they said, oh, this is women's business. This is women's business. And I said, yes and no. Like, you need to care about this. This needs to be a priority for you. But yes, like, there are certain people who need to be in leadership of this. That may not be you necessarily right now. Mm-hmm. But there needs to be a level of acknowledgement and honoring by everybody in every generation to recognize the importance and the depth of this work and this process that families go through to bring about the generations, right? And I think that what's been really powerful in my life as a midwife is being able to educate entire families about labor or about breastfeeding and kind of bringing that knowledge back to our families and recognizing that we've gone through a process of loss of knowledge in so many areas of life, that slowly kind of just planting those seeds again and kind of bringing that knowledge back. Midwives were never the only people who knew about a lot of this stuff. And yet we're in a situation where we're holding all this knowledge that people should own. And so one of the kind of most helpful and amazing things that I've done is be able to do kind of intergenerational sharing of knowledge. And, if you're doing a little prenatal session, to make sure that auntie and grandmother and sister and brother are there, and making sure that we're kind of all regaining that knowledge together, and that we're not only restricting it to in your prenatal appointment between the doula and the person having the baby or the midwife, and we're not restricting that knowledge to there, and that there's a certain kind of knowledge that should be shared, and that we're kind of, to be healthy, we need to make sure, people are informed and have access to this knowledge that was very common at one time. So I think that's a fun way too of involving the family, is talking about like what happens in a birth, and talking about things like that.
Yeah, great. So we're kind of
Marion chipping in there. I see her.
Oh yeah, it's a different.
Yeah, I was just reflecting on my own research. One of the things that I found with Lee Jack Residential School is that it was sex segregated, so the boys were on one side, girls were on the other. And that really changed a lot of the dynamics in the community to be that that's the woman's issue, like not going to go anywhere near that. There was in the death of community protocols around males being in births and stuff. And I think some of these things could be fun to implement. For example, if a male was very nervous at a birth and maybe he was starting to get faint, then the DACSTKLT would chase him out so that he would have to run. He would have to run and not stop running until his wife had the baby. And the idea was that this running would speed up the birth. But I think that it was also a way to bring equality amongst the genders, and it would prevent men from fainting during labor. So I thought that was really fun. It's like really cool if the maternity ward here in Prince George had a treadmill. Can you imagine how helpful it would be to chase these men out of the birthing room and send them on a treadmill? I think they could reflect on their own personal health while their wife is giving birth to the next generation. So
that is so funny.
Their wife or partner,
That's so funny. And I think as those of us who attend births can recognize what that energy brings to the room when somebody's really nervous, right? It can really change the energy of the birth. And so I from a midwife perspective, when I hear that right away, I'm thinking, oh, they need to clear the energy. They need, like, that energy isn't helpful to the baby coming. So do we need space? You go and do that.
Wouldn't it be nice? Go run on that treadmill.
Yeah. And also, when you think of it from a physiological perspective, you're getting their blood circulating again. So their blood isn't all sinking. They're like, oh, I'm going to faint. That they're actually kind of getting their heart pumping up again. And That's really funny. Thank you for sharing that, Marion. That's hilarious.
Thanks, Marion. So I just wanted to kind of bring us back to a couple questions that were addressed earlier, one in particular from Donna, and I kind of was hoping to hear from just roundtable kind of everybody's perspective on this. To remind everyone at home, I struggle to know how to support Indigenous moms in our community in a culturally sensitive way when an Indigenous provider isn't available. How do I support traditional teachings when I don't know them? I don't want to assume people would want to share their practices with me. Is there a conversation about this? Donna mentioned that she is not Indigenous, so she's an ally, obviously working in community. And then as a follow-up, how would you suggest approaching this other than just generally trying to be approachable and engage in shared decision-making, respectful, etc.? So I think, Evelyn, if you could kind of kick us off and kind of kickstart that conversation a little bit. And we'll
Donna's from Penticton.
Donna is from Penticton.
I recognize Donna's name now. Hi, Donna. So my response to that is always, you don't have to know what the tradition is to make space for it. And people don't have to share with you what it is that they want to do, but making space for that and opening that space and honoring that space is just really important to allowing people to kind of explore that within themselves. Sometimes we ask people, so say, for some people, they may not have considered how they might want to bring cultural practices into whatever it is they're doing, let's say into their birth. And they may not have thought of that at all. And other people may have been putting a lot of thought into this for a very long time. And so sometimes you can just say, like, have you been thinking about this? What does this mean to you? And kind of gauge, should we work on connecting you with someone? If it's someone who's completely unconnected, right? We know that we have a lot of people in our urban communities especially who may not have, you know, a family or a connection. Then we start to look at our friendship centers as resources and say, like, maybe we can make a link there and do that. And that can be our role as any care provider. Anybody involved in taking care of people through this is just supporting those connections to be made and holding the space. And we don't have to be in the space, we don't have to be involved, but knowing that there's something that needs to take place, creating and honoring that space and holding that space for those people to do what they need to do, that's all we need to do. You know, and for me, like, my nation is way, way far from here. Like, I'm a visitor here. I'm not always familiar with the way things are done. And so I'm in the same position where I'm saying, what you know, what would you like to do? Or is there something that you would like to do? How can I support you to get there? And you know, it's the same way for me being a visitor here. And so I always just say, you don't need to know what the tradition is to make space for it. We know that, yeah, and then to support people in finding the knowledge or seeking out the support people that they may need to do the things that in their heart they are hoping to do.
Yeah, thanks for that. And I love that you mentioned that any healthcare professional, that's good advice just generally. Like, you don't need to be a part of it. It doesn't need to, you know, it doesn't need to concern you. Just making space for that and honoring and respecting that traditional body of knowledge and where it comes from. Sage, do you have anything to add to that? I thought it was a great answer, by the way, Evelyn. But Sage, do you have anything to add to that?
I think just going off of what Evelyn said was that helping find those people too. So oftentimes, like, that person might not even know what the practices are, and so maybe they are interested in finding out some of the practices, what their choices could be, and so. I think if you're in close proximity to local community, to kind of reach out to the community and seek ways to get involved, and just make yourself aware, or like introducing yourself to community members, finding out who the community health representatives are, and just being present in the community too, building those relationships. And finding people that are passionate about this work too, and then holding those relationships with them and really supporting them in their work.
Yeah, that's really great. I like that. Just practicing strong kind of allyship, right? In terms of creating relationships and put effort into maintaining and nurturing those relationships with community members, particularly if you're near a community that you work with a lot.
And I think too, like, a lot of this knowledge is lost in a lot of ways, right? Like, I know for me, it's been hard to seek a lot of our traditional knowledge from our ways because the people that held that knowledge have passed on. And like, particularly in Kamloops, we've had a hospital for quite a while. And so our reserve is so close to our city center that a lot of people have been having babies and stuff at our hospital. So, you know, it's my grandma's generations. Like, I heard one of the elders a couple of years ago talk about she remembers her mom having her sister at home, and that's kind of been it. So it's like still been quite a while since any of that was happening. So a lot of that knowledge is gone, and we don't know it. So it's hard to find it, but I think just reaching out, some people do know.
Yeah.
And if I can add to the hospital piece there, like, a lot of our, like, as a midwife who works in hospital and at home, like, midwives attend births in hospital and outside of the hospital. And so, which is kind of like, I didn't even really go through those basic facts in this. So, But we can do a lot in the hospital. We can create those spaces in the hospital. Some people need to be there. And so it's, we'll have 30 people in a room welcoming a baby. And that's the thing that we do. We enable that because that's an important thing for that baby and for that family to do. And so our hospitals aren't there to limit us. And we can always challenge policies, and we can always ask questions, and we can always advocate for each other and for ourselves. It's really hard to self-advocate. So as people who might be working in those settings, we have a huge responsibility to tap into what the needs are of the family and advocate for them to make sure that they're getting what they need and able to have the space to do the things they need, whether that's ceremonial or about protocol or anything like that.
Yeah, thanks.
I think one of the things that I deal with here in the north is that a lot of our, like the doctor trainees that we deal with and the nurses, they are taught specifically about boundaries, about work boundaries and things like that, about not sharing too much about yourself, kind of like professional relationships. Very Western idea of medicine where you're patient and doctor, and these are two very different things, and that there should be this boundary. But in the north, I know that it's very different in rural communities. For one, I remember at 16 years old, and this is when some women are having their babies already, is that they've never had to make new friends before. And being a care provider, and usually here in the north, it's somebody new. There's this ideal of personal distance, when really introducing yourself could be more along the lines of introducing yourself and saying where you come from, like, hi, I'm so-and-so. Maybe you're talk a little about yourself than what's normal for certain doctors and stuff. And then also asking the community what their needs are. I know here in the north and in the rural communities that the needs might be very specific and might not be something that people have thought of before. So like asking, hey, maybe your mom could come next time. If a woman, it's usually younger women, feel really insecure, not really answering very many questions. Maybe they're not sure about some of their traditions and stuff like that. And they have this new person in front of them, asking them about these things that might be traumatizing to them because they don't know. It might be just a matter of just asking the community, what do you think? How can I help? And asking collectively, because I know that here in the north, the collective needs of the community are really important. For one, just dealing with some of the patriarchy that has influenced the minds and hearts of the men in the community can be really challenging to deal with when you're a care provider and you're asking a woman about their support. And yeah, so I think there's that. It's changing your practice to be more collective in nature.
Yeah, thank you for that, Marion. That was really nice. Follow-up question or follow-up comment from Donna says, "So be a human being," and I think that really kind of sums it up. And importantly as well to highlight that I think that generally healthcare professionals are working towards that, and we have great people like Evelyn in really key positions that are influencing education and kind of trying to bring about those changes, but just the reality that it's going to be a slow process. So that's where we come in as a learning circle to offer these kind of educational supports for people that are already practicing in the community. So with that, we've kind of run out of time. So I just wanted to say thank you, everyone. Marion, Sage, and Evelyn, thank you all very much for coming in and talking to us today. I really enjoyed this conversation. There's lots of things I didn't know about lactation support.
Can I just
yeah, of
interrupt you
course,
for one
Evelyn.
sec? There was one question we had highlighted that we wanted to address that
Sure.
we don't have time, I guess, to address, but it's about suggestions for resources around supporting people with sexual trauma.
Oh,
And there is there's a book that is like kind of the main resource. It's called When Survivors Give Birth. That's kind of a key resource to have, and we can link to that underneath. That's all I wanted to say because it's a
Yeah,
whole conversation.
Wanted to mention that too.
Yeah,
Yeah, my
it's a
apologies.
whole. It's something that we could probably have a whole learning circle on
Mhm.
maybe next year. But I'm glad that you brought that up, and so we'll link to that resource when we do that.
Yeah, thanks very much for bringing that up, Evelyn. I appreciate it. I'm sorry that it momentarily slipped my mind, but yeah, we'll be sure to try to offer those resources for you to get those questions answered. Again, sorry, everyone. Thank you very much for coming and for participating. Coming up in the rest of the month, we have a couple more sessions on birthing. So as Evelyn mentioned, next week we have one on pathways to midwifery. So talking more about the educational pathway into becoming a midwife in BC, I guess, and generally, but in BC in particular, and reflecting on the students' experiences. And then at the end of the month, we're going to have some members of the doula collective come in, some Indigenous members of the doula collective come in and talk about supporting birthing community in that way. So I hope that you'll join us for those sessions. So that's all from us today. Thanks again very much, and we will see you later. Bye.
Bye.